Good morning.
Let's talk about it's not finished with that study, and it should be called into question. True?
Absolutely. I mean, and that's what I was talking about just a few days ago with these clinical trials. This is good information, but in general, if you're looking at drug development in a normal world, this is something that takes years to do. Huge numbers of people watching over a long period of time, looking at all the variables that may impact on whether a drug works or doesn't work. So while we get all excited about this preliminary information, we really have to take a step back and wait before we all jump on board.
Yesterday in the president's news conference, he asked his medical experts sort of on the fly whether disinfectants might work or UV light. What were your thoughts on that?
I'm not going to tell you my thoughts because it's not appropriate for morning TV. But let's just say that not only is there no science behind that, the things that you can put on a counter on a surface is not something you put in your body. Crazy comes to mind, but no, you should not be ingesting your Lysol. You should not be, putting light in your mouth. I mean, it's really crazy, really inappropriate.
There is some history with ultraviolet light, this ultraviolet blood irradiation. That's been used in the past. Is that something different than what he was talking about? And what is that?
I mean, quite frankly, I have no idea what he was talking about. But even the preliminary data that you see, a lot of times things are done in the lab, but it doesn't translate to what happens in the body. And that's one of the things that's so confusing, because if you can do something in an animal or in a laboratory test tube, that doesn't mean that it's going to work when someone is actively infected.
But is there truth to
difficult.
Ultraviolet light and having any benefits, or maybe reducing this?
And a radiation therapy for blood.
Yeah, honestly, I'm not familiar enough with that data to comment on it. But I certainly know that there's nothing with COVID specifically that has been shown to be promising.
Gotcha.
All right. And everybody's anxious for these antibody tests. In New York City, they had a 21% positive rate. What does that tell you? What does that tell you? And what does that mean as we try to, make plasma for people?
Well, I think what this tells us is that, as we already know, a lot of people are infected. A lot of people that have antibodies weren't symptomatic, but that they may be able to donate their plasma to make antibodies. But we don't know how long these antibodies stay around. We don't know how long they're protective. That's one of the big question marks. If someone tests positive for the antibodies, are they protected for a month, 6 months, a year, forever? Nobody really knows. But I think that this is technology that we're going to continue to hear about and could be potentially very important.
All right, let's get to some viewer questions. Here's one that says, I read that smokers could be less at risk of catching the virus. Is this true?
This is absolutely the most fascinating thing I've come across in days, because when I first saw this, I thought, no way, you can't say anything good about smoking. But it appears that, people that smoke tobacco have a significantly lower risk of getting sick from COVID than non-smokers. In other words, smoking may actually protect you from the virus. And this all started with a French study that was released just a few days ago. And what they found is that only 4.4% of coronavirus patients that were hospitalized and sick were regular smokers, but 25% of the French population smokes. And in the U.S., the CDC released a report that said that 1.3% of hospitalized COVID patients were smokers, but 14% of American population smokes. So this is really striking. And in fact, the statistics are so striking that in French hospitals, they are now giving frontline workers and COVID patients nicotine patches to see if that makes a difference. So this is interesting. This is why it's theorized that nicotine might actually work. We know from past research, from very good research, that nicotine damages receptors inside the body called ACE2 receptors. The coronavirus needs those ACE2 receptors to get in the cells and infect someone. It's their doorway to the cell. So if those ACE2 receptors are broken, the virus can't get in. The door is locked, and it appears that nicotine damages those ACE2 receptors. So this could be potentially something. The other theory is that nicotine prevents the immune system from overreacting to the virus. No one is suggesting that you start smoking. I want to be clear on that. Smoking is bad for you. You'll die from something else. But a nicotine patch, maybe. And unlike ingesting Lysol, nicotine patches in general, some people can have side effects, dizziness, nausea, headache. But in general, these aren't dangerous. So I'm not telling people to go out and put nicotine patches on, but I am saying stay tuned on this one, because this is real interesting.
It seems like we get new info and a new study every day.
every hour.
Yeah,
it's like all I can do to keep up with my medical feeds. You know, they're just coming in all day, every day.
All right. Thanks, Dr. Streicher.
Stuff,
if you have a question for her, you can go to drstreicher.com. Let's get it.
I like life. The other day, my